This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your phone calls on anything you'd like to know about natural health care. Call me, 888-630-9625. That's 888-630-9625. Love to talk to you. Let us know what you have in mind and things that you've tried about, to fix the things that are going on with you that haven't worked. Well, here's an opportunity. Let's kind of turn that matrix around a little bit and give you some data that you may not have even thought about. That's the opportunity that you have here with Dr. Tom Roselle Live. We have a program today, and one that, even though that it's designed and kind of, positioned as a female topic, guys, pay attention. We're going to talk about hormone imbalances as it relates to women, but I'm going to make sure that you guys understand that you go through the same problems as well. This Wednesday evening at the Roselle Center for Healing, Dr. Stephanie Pina will be your host, your presenter, and she's going to be talking about balancing female hormones. It's the 15th of June at 7 p.m. at the Roselle Center for Healing. We'd love to have you as our guest. We'd like to encourage you to find out what you can do to make a difference in your life. All you have to do is call 703-698-7117. So, as we get into it, and Dr. Pina's with me in the studio today and will be your presenter, but here's just kind of a checklist, from ladies, you go from PMS problems, right? Premenstrual syndrome into perimenopause, then menopause, then, into everything shutting down and things going wacko. Guys, you do the same thing. That menopause thing for women, it's called andropause for you. And you have the same problematic situations. And ladies, you can go into all kinds of things from craving and mood depression and loss of libido and I hurt all over and acne and facial hair growth and loss of hair and ovarian pain and infertility problems, if you're still in that place, and dizziness and blood pressure gets crazy. It usually drops in many situations. Water retention. I mean, it's a huge list. Grouchiness, grumpiness. I know you're pointing at your husbands now and saying, yeah, that's you. Guys, that's why I said pay attention, because we get to that place where when our hormones go down and you start accumulating female hormone, is called estrogen. We do that because of our environment. We do that because of our foods. We do that because we don't have the capacity to break it down and get rid of it. And we go hand in hand with the same type of symptoms. It's called andropause. So, ladies, even though we're talking about balancing hormones, don't let your husband or your significant other go away. Lock them down. Dr. Pina, welcome. Did I segue it all right?
You're gonna lock them down? I'm
gonna lock them down. I'm gonna lock them down because if Sue's listening right now, she's gonna lock me down, and I'm gonna be in trouble when I get home. No, seriously,
it'd be more of an interesting lecture than I thought.
It could be a very interesting lecture. Seriously, let's talk about the imbalance in female hormones. And the first question that I have is simply this: this seems to be more of a Western civilization problem. Why?
Well, what's interesting is I think we have a lot more different exposures in the West than they say do in the East and stuff. However, that is changing. And what's interesting the most is I think a lot of that has to do with our dietary factors. We're getting exposures to increased estrogens. Our fat consumptions is much different. We have much more of, even though there's the trend to change the fat to good fat, there's much more fat and sugary foods and carbohydrates that are increasing insulin factors in our typical diet, and our choices of foods are, available to us. We're not restricted to what we need. So we're seeing that much more in the West, and that's playing an effect not only on our digestive tracts, but on our endocrine system, which is what produces hormones to begin with. And that effect does not really care if you're young or old, if you're male or female, if you're healthy or not. And in the West or in the East, they're seeing this more and more as you see some of that food carry over. There's a lot of studies, not just with, female and male hormones, but even digestive tracts and chronic disease, where you're seeing, people basically moving from their cultural homes into big cities where they have more exposure to that, and they're developing these chronic illnesses that their home status doesn't have.
It's an interesting situation. As you know, I'm first generation from Sicily, and my father came in, and he was a hardworking guy and so forth. And at one point, he wasn't doing very well, and he went to his doctor, who was from the old country as well. He was a cardiologist. And he told my father, he said, and this was years and years and years ago, so you magnify this, multiple times today. He said, Russell, he said, go eat what you used to eat when you were growing up in the old country. And, the foods were cleaner. They didn't have the preservatives, the additives, and so forth. And, my parents were hairdressers, so he was exposed to all of the environmental pollutions. In those days, everybody smoked in the salon, right? So they had all these pollutions coming in. But all these factors that we're talking about, whether they're direct influences or they're byproduct of our environment, it has a profound impact on us and subsequently hormonal balance.
Right. And as foods start to change, whether we discuss GMO types of foods and what that impact's going to have, or the fact that we've moved away from even seasonal eating because, we can get everything frozen, refrigerated, and preservative at this time. You see a change with that over time. And not only is that affecting our daily lives and what we're eating, but it's also affecting the other parts of the body that are necessary for hormone production, development, and the pathways, such as what's going on with the adrenals and the liver and the parts that we don't take into consideration that are related to our reproductive hormones that we think are, we don't think of them because we're just thinking about estrogen, progesterone, and testosterone.
And which is just the beginning loop. I mean, that's
right.
That's like way downstream before
right.
we can get there. We have to, you have to go upregulated to the pituitary first, and then all the signals that gives out. And then what we have to remember is that there are hormone signals that signal other hormones to do what they're supposed to be doing. There are energetic pathways that also help regulate that. The nervous system, the brain, the spinal cord, the nerves that come off of that, the regulation of spinal fluid flow, all these things have to do with what we're talking about.
And that's why you see with this dysregulation, like you mentioned, all those symptoms, it's affecting us. We talk about the triad of health. It affects the symptoms you just mentioned, structural, emotional, biochemical, they're all right there, and they all play together because they're all interrelated. And one hormone feedbacks into the other one to shut down or start up the production of a different hormone. So you can't just say, if I just balance this one hormone, the rest of my symptoms are going to go away, because it doesn't work that way.
People don't understand that the impact of hormonal regulation in the body relative to immune function and just how your brain works and your emotional platform is a balancing act, and it's a very, very critical balancing act. So, for example, in today's world, particularly in Western society, we are bombarded with this thing called xenoestrogens, or outside the body estrogenic stimulation, from electrical waves to plastics to when people drink a bottle of water, they go to the store, they get in a plastic bottle, they're getting an estrogen effect in their body, so now they become estrogen dominant, segueing into the increased presence today of breast cancer and prostate cancer. And, years ago, breast cancer in men was unheard of. And today, some authors will tell you 3 to 5% of all breast cancers are male. And it's because of this dominant estrogen effect, because environmental platforms, and we can't get rid of this stuff.
And if you reverse that too, and we think that testosterone is always a male issue, what you're seeing with female is that increased testosterone can affect things like polycystic ovarian syndrome. They can affect, and that in itself affects your glucose levels and your blood sugar levels. So it's this fine balance between keeping your hormones into place, but then also understanding how they are broken down in the body and how they function properly and how can we affect it from the outside in and the inside out.
Hey, listen, guys, you have an opportunity this Wednesday evening to listen to one of the brightest that I've had the pleasure of ever working with in my practice. She gets it. She's a doctor of naturopathic medicine. She's a licensed acupuncturist. She is an expert in herbs and so forth. She knows her business. Here's a time when you really can ask questions. You can learn these loops and how they actually manifest in some of the symptoms that you're presenting. And all you need to do is call the Roselle Center for Healing at 703-698-7117. That's 703-698-7117. Tell the staff that you'd like to attend. There's absolutely no charge. It's our gift to you. We do this to educate you, and you can ask every question that you possibly could think of relative to why am I doing this? Why is this happening? Guys, you know that grumpiness and that loss of drive and that depression and all those things that have been bugging you? That's what happens when your testosterone goes out the door and everything drops. And it's not about you going out and getting testosterone creams and gels. It's not about you going to, the different health food stores and getting all these pro-testosterone boosters and so forth. There's a reason why your body's not working the way it's supposed to. You need to step up and find out and do something proactively. Take a look at your midline. If you grab your belly and you got a lot of this loose fat that wasn't there before, that's cortisol fat, and that's binding estrogen in your body. That's holding estrogen in, and you're going to end up with problems subsequently to that. Dr. Pina, we see young girls as well as, older women going into huge hormonal imbalance. We see a lot of depression today, a lot of anxiety-ridden situations. How does all that relate to what we're talking about?
Well, we know that all the hormones play an effect on the brain because that's where they're basically starting from. It's funny you bring that up because I was this morning listening to a past show we did when we were discussing sweetening the pill and the
yes.
and the effects of the birth control pill, and no more so after I started reading the book too. One of the first things that they discuss in that book is basically the effect on the mind. And the way that they sold it. You're going to be happy and healthy and look great and all this stuff. Well, who wouldn't want that? So of course, why not get that as a benefit from, also not having to worry about pregnancy at the same time. So we know that there's their interconnection, and also it's good and it's bad, right? We feel it. We feel great. We keep going. We don't want to change what we're doing because why would we want to feel horrible? But we know that that's just a side effect of everything as well, too. There's that increase of, cortisol that we have with normal day stressors that if we're not dealing with that, that's going to play a major factor as well.
But here, a woman goes to her doctor, a guy goes to the doctor and says, well, there's nothing wrong with you. Your hormones are normal. Why aren't these hormones acting the way that they're supposed to?
Well, a lot of time because they're not looking at the other systems and how they're broken down. And I know when I first got out of school, I went into a practice that they brought me in to do bioidentical hormones in Arizona, and we worked with a compounding pharmacist, and we did saliva testing to see what the hormone levels are, which is a very different kind of testing than blood testing, which is what conventional medicine does. It doesn't tell you what actively is going on. So you can have hormone production, but you're not feeling it. The cells aren't working with it. And the truth of the matter is, even when I got out of school, there was so much more to learn about this that you didn't get taught, that you don't get exposed to.
Like
and a lot
nothing then.
Yeah, and a lot of the doctors don't understand how that goes. Why? Because they get told this is going to be the best prescription and this is the newest and the latest and greatest because it's got less or more estrogen or progesterone and it's going to be better for these types of people. Not necessarily true.
No, it's not necessarily true. And when you start exposing people to hormones, particularly in an unbalanced manner, you're driving it down further through the symptom process, which ultimately becomes pathological. And that's where you see your cancers. That's where you see your degenerative disease. That's where you increase the perpetuation of mental deficiency, if you will, or memory loss and old age dementia, which a lot of that is rigged to hormones. The thing of it is that there's so much that you can do to stop that and reverse it and make a huge difference and reclaim your life if you're willing to do the work that it takes to get it done. And by the way, it can be fixed. You don't have to live with the stuff. This Wednesday evening, Dr. Stephanie Pina will be your presenter, your host at the Roselle Center for Healing. All you need to do is call 703-698-7117 and say, I want to be there, and we will confirm that. We'll be right back after these messages.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Balancing Female Hormones, Fertility and Menopause on Wednesday, June 15th at 7 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com. That's rosellcare.com.
Attend 3 Keys to Ageless Health, Unlocking Your Wellness Potential with Dr. Tom Roselle, D.C. on Thursday, June 23rd at 7 p.m. at the Courtyard Gaithersburg Washingtonian Center. Structural, chemical, and emotional stress can destroy your health and create disease. Create a lifetime of optimal wellness by applying these 3 keys to Ageless Health. Eliminate chronic pain and decrease your risk of cancer, diabetes, and heart disease. This is a free health event sponsored by Caring for Others, Ltd. For details, call 703-698-7117 or visit agelesshealthevent.com.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. I'm in studio. Call me, 888-630-9625. That's 888-630-9625. We're talking about female hormone imbalances. And like I said, guys, don't go away because the same pattern affects you. The difference between you and your wife or your significant other, or ladies down the road, is simply the balance of hormones. And you have to understand that. And when you're exposed to estrogens, those male boobs that some of you guys are getting? That's estrogen. That's cortisol storing estrogen. And that's why you got those things. And you can get rid of them. It's a very straightforward, but you got to make some changes. And there's things that can be done. And in studio to talk about all kinds of hormonal imbalance, Dr. Stephanie Pina will be your host, your presenter this Wednesday evening, the 15th of the month, 7 p.m. at the Roselle Center for Healing. All you have to do is call 703-698-7117. Tell them that you'd like to be there. Dr. Pina, let's talk a little bit more about, this whole hormonal dysregulation, if you will. And the problem is in our society, that we have so much coming after us from electronics, microwaves. We have the pollutions, the additives, the preservatives, the plastics, the stress patterns, all those things, as we talked about earlier in the show, that are more significant in this part of the world than other parts of the world. But the prime mover to get rid of all that is the liver. And if the liver is not working properly, we have all these problems we're talking about.
Correct. And what's interesting is in Chinese medicine as well, the liver is I always call it the emotional and biochemical detoxifier, because everything we bring in, whether it's food, medications, emotional stress, everything has to be processed through the liver. And when it doesn't process it well, it stagnates and we hold on to it just like we're holding on to the estrogens in our fat cells. So the liver in itself has to break everything down. So if it's having trouble struggling to break down our normal food that we're bringing in, how is it going to do when you add synthetic hormones in there? How is it going to do, and how is it going to process when you have hormone therapy and lipid and statin drugs and everything else that are going there, which all conflict with each other? It's a tough thing, and we don't really necessarily worry about how do we detox the liver necessarily on an everyday basis. We just keep putting it in because, like a good little liver, it does what it needs to do, supposedly. We keep functioning, but it's not doing that in the long run, and then that's where we start to see that backup system. The trash keeps backing up until someone takes it out, and that's the job of the liver, and when it can't function properly, it's not going to do it.
It's like walking into the bathroom and smelling the toilet backing up. I mean, that's very similar to what's taking place. It's not able to get rid of, denature, break down, eliminate all the toxins, and also dealing with those hormones, because that's a very specific pathway in the liver. It's supposed to break them down and get rid of them, and it gets rid of them through the bile, through the intestinal tract, and out. So you have a loop that goes back and re-stimulates, by the way, called this little thing called the pituitary. And there's a whole bunch of little glands up there that work in synchrony, but that has its own cascade of different types of hormones, from luteinizing hormone to follicle-stimulating hormone, you name it. And guys, they affect you as well. So we've got this problem. So Dr. Pina, if I was going to ask you, tell our patients what they could see in themselves that would suggest that perhaps liver's not working the way it's supposed to.
There could be changes with circulation. I mean, we talk about liver spots. That can be
those little red spots.
Those little red spots that sometimes they look different than age spots, but that can come out because the skin is a detoxification organ. You can start to see things backing up in the digestive tract, so increase of leaky gut type of symptoms. If your body is certainly not if you're not going to the bathroom, you're certainly not clearing any of this stuff out either.
Constipation is big in this country.
Oh, yes. And then, you do see the emotional changes, the mental emotional changes too, because if those toxins are floating around in the body, they're not supposed to be there. They're going to start causing heck and havoc and destroying normal good cell functions. We talk about good cholesterol and bad cholesterol. Well, even when the liver's breaking stuff down, those metabolites almost give you good estrogen and bad estrogen, just like it can give you good testosterone and bad testosterone. So if you have the bad testosterone and the bad estrogen floating around because your liver's not functioning, that's going to stimulate cell growth that you're not going to want.
Yeah, absolutely. And then you end up with the pathological end product of cancers and things of that nature. So here's, as we talked about, if you see those little red spots all over your body about the size of a pinhead, and those are liver spots, and that's an indication that your liver is not clearing. If you look at your eyes, and your eyes are, dark, but they're puffy, they got bags underneath the eyelids, those are indications of that the liver is not working the way it's supposed to. If the liver or the skin looks a little tingy yellow, that's another indication that's not working. If you've got that jelly belly, that's another indication that the liver is not working the way it's supposed to. If you go down onto your foot, in between your big toe and the next toe in, and you go into where about a half an inch beyond where the web is, and you press hard and that's sore, that's an acupuncture point for the liver. And if that's sore, you got a problem. So there's a lot of things that you can look at yourself that would begin to suggest that maybe, all of these symptoms that you're going through, this, I don't feel good, I'm moody, I'm losing bone mass, I can't get this belly off, I hurt all the time, I can't think, my brain's not clear, my blood pressure won't regulate, my thyroid's not working the way it's supposed to, I have no libido whatsoever anymore. Those can all be liver function considerations. And by the way, the list is much, much greater than that. So there's a lot of ways you can do that. This Wednesday evening, the 15th, Dr. Stephanie Pina will go over those and a whole lot more with you. We're coming up to a break, and we have to pay attention to those who bring you Dr. Tom Roselle Live. Don't go away. We will be right back.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. Indeed, we're in studio, 888-630-9625. That's how you find us here in studio. By the way, when we're not in studio and you'd like to get a message to us, go to rosellecare.com. That's ROSELLECARE.com, rosellecare.com. And send us a note, and to any of the doctors and practitioners at the Roselle Center for Healing, and they will get back to you. This Wednesday evening, Dr. Stephanie Pina will be your host and your presenter at the Roselle Center for Healing. She's going to be talking about balancing female hormones. Guys, you're welcome to come as well. You can call our office at 703-698-7117. That's 703-698-7117, and tell staff that you'd like to be there. Reserve your seat, because when we are full, and that's that. So please reserve. And by the way, if you're going to reserve a seat, make sure you show up, okay? Want to just give a little kind of tease that I'm going to be up in the Gaithersburg area on the 23rd of this month, and I'm going to be doing a special presentation called The 3 Keys to Wellness, and we'll talk about that next week on the show extensively, and there'll be some things on our social media. You can go to our Facebook page and click in there, and we're always keeping you in touch, so just remember that as well. But this Wednesday evening, more importantly, Dr. Stephanie Pina will be your presenter. Bernice, thank you for being patient. How can I help you?
Hi, I have a comment. Dr. Marchstar out of Phoenix was saying that when you fix the hormones, he's been able to cure people from Alzheimer's, be able to turn it around.
Well, funny you should ask. Alzheimer's is growing exponentially, and for a lot of reasons, and we're not going to get into a long conversation about it because we have to cover the topic today. But it's one that causes the brain to shrink and to begin to degenerate and deteriorate. And it goes through many stages once this happens. There's a lot of things that can be done. Most of the medical therapeutics to control Alzheimer's really don't do much, except maybe quiet the anxiety and the upset that the patient has. And that can make a difference, particularly as the patient gets into the middle to the end stages, where, unfortunately, it's a very sad and emotional time for the patient. The patient knows what's going on. The family's watching this, and then pretty soon the patient doesn't recognize family. Now, there's a lot of things in the natural community that have been tried and known to work. And Dr. Pina, you're welcome to jump in on this if you'd like to. But everything from acupuncture to low-energy light laser, but from a nutritional point of view, and I've been doing a lot of work with this recently simply because of the fact that there's an extended friend of a family member who is with this, and we want to make sure that we have everything that is available. And we've treated a lot of old age dementia and Alzheimer's patients over the years cooperatively with their doctors. But medium chain triglycerides, we call them MCT. There's things like coconut oil and caprylic acid. Those are both MCTs. And they seem to have an effect. Huperzine, which is omega fatty acids, but at very, very high levels. Phosphatidylserine also helps calm and bring the brain back into balance where the neurological connections. Taurine, Taurine, is known to actually regenerate cells. Ginkgo will also help. Ginkgo rose will help open up the small vessels. We use niacin as well with some patients, which works on the small capillaries. Coenzyme Q10, the brain and the heart have the highest concentrations of mitochondria. And as the brain begins to degenerate, it does so seems to be in the absence of enough coenzyme Q10. So using that at very high levels, those are things that can be extremely useful. You really need somebody to guide you through that and walk you through one piece at a time. I hope that's useful, Bernice. You can always send me a note and make a and I'll send you some other information. Give us a call, 888-630-9625, 888-630-9625. Dr. Pina, talking about hormone imbalances and the topic of Alzheimer's and old age dementia and so forth, in some situations, there's some parallels. There's some things that seem to be consistent one with the other. Maybe if nothing more than the brain itself is the regulating mechanism for all of this stuff.
Yeah, everything. I was going to add everything that you just talked about, especially the first few with the triglycerides and the essential fats. I mean, that's the base of all hormones, especially sex hormones, that's the base of it. So if that's not able to be in the body and utilized properly, the brain also wants and needs to use that too. I mean, I always think of some of the essential fats basically kind of being like the insulation over a piece of wire, and that wire is like your nervous system, and if it's not insulated, it can't fire as quickly as it wants to. So not only are you looking at preserving brain tissue and functions and neurons, but then you don't have the factors that are going to create the sex hormones later on down the line. So you definitely see a change with that. And some of the original studies that were done on some of the hormone replacement therapies, like the Premarins and stuff that's out there, they originally thought, so it'll help with brain function. Well, they had to stop these studies because essentially they noticed it was creating more of an issue with dementia. And then to turn it around, they basically said, it'll be beneficial if you get it in early menopause versus later menopause. It'll have more of an effect on you. But that wasn't necessarily true. So same thing with birth control pills. If someone's taking it not to get pregnant, it has to affect some of the vital nutrients and stuff that we need, like the B vitamins, that are needed in a lot of different processes in the body. So if the body's being blocked by some of these therapies that are put out there to affect hormones, to affect brain function, it can actually be creating more of an issue than not.
Well, we know that increased estrogen in the body, particularly in the female body, increases the risk significantly, particularly if they're smokers or exposed to smoke or tobacco, increase the risk of stroke and cerebral vascular problems. And subsequently, when you have TIAs, trans ischemic attacks, which are mini strokes, some people will say, it can cause a profound impact, particularly if it's at the lower portion of the brain in the middle. If I had to tell our audience where to find it, you go to in your mouth where the hard and soft palate come together. If you go straight up from there, there's a little saddle that the pituitary sits in. And so the blood supply to that area is critical. And by the way, it's very profound. It's very significant. And if we do that, if we don't pay attention to those pathways, we're missing the boat completely, I think.
Mm-hmm. And that same pituitary gland, which is basically kind of like the signaling system to the rest of the body, has an effect also because it's not just releasing to the sex organs, it's releasing hormone information to the thyroid gland, it's releasing hormone information to the adrenal gland. And so all of these all play into parts. So you see issues with thyroid and adrenal increase when you see these, what I like to call transitions in hormones. You have your transition during puberty, during pregnancy, and then that perimenopause, menopausal phase 2. That's where things start to get stirred up. So that's where you see the most symptoms, and all these other organ systems that are related to the endocrine system get thrown in there too.
I'm going to take a phone call, but when we get done with that call, I want to talk a little bit about the connection between mumps and hormone production, because there's kind of an interesting relationship. Let's go to Diane in Arlington. Hi, Diane. How can I help you?
Hi. I have a question off topic. It's about scar tissue. I had foot trauma, and I've had scar tissue build up under the metatarsal to where it's actually raised the metatarsal to where it feels like there's a bone bump on the top of my foot. It's very, very painful. I've been told that the only way to get rid of the scar tissue is surgery. Is that true? Okay,
so the scar tissue, just to make sure that I'm with you, the scar tissue's on top of the foot on the metatarsal area?
No, it's on the bottom.
It's on the bottom of the foot.
Right where the metatarsal hits the toe.
And it was from trauma, from injury?
Yeah, from jamming my foot into a door.
Okay, and it was never from injury due to a cut or injury due to surgery or anything like that?
No, never had surgery on it.
Okay, so Dr. Pina, here's where my thought goes, okay? And we're talking about injury to the base of the foot. Do you wear heels a lot?
No, I haven't worn any. In fact, the only thing that's comfortable is foam flip-flops.
Okay, and how long have you been playing with this thing?
The better part of about 5 years, but the last year or so, it's gotten so painful it's very hard to walk.
Is the scar tissue palpable to you, or are you told there's scar tissue in there?
I've been told from both an MRI and a reflexologist that there's scar tissue there.
Okay. So on the bottom of the foot, there are acupuncture meridians, and one of the major meridians that brings the primary energetic to your body is called the kidney meridian, and it's right at the bottom of the foot. And there are other meridians throughout the entire foot. Now, injury can be as a result of an arch that dropped. It can be as a result of the bones being misaligned in a way, particularly the talus and the calcaneal bone, which is your heel, and then the next bone after that. And any of those things can cause it, or any of the energetic imbalances, or muscle weakness that is not allowing any of those things to function properly because of a problem in the low back. So you would look at all of them. But let's set that aside for a second. And if it's muscle weakness, if you restore muscle function and you put the right enzymes in the body, even going to the things if the body tested for the glucosamine sulfates, the chondroitin sulfates, the MSNs and so forth, but in the sulfate forms, decrease the inflammatory reaction using scavengers that are proteolytic enzymes at very high dosages on an empty stomach, low energy light laser, and then acupuncture. Dr. Pina, jump in on this thing, because you and I have both seen these many times before.
Yeah, and what's interesting, too, is you got to remember anytime you do surgery as well, either it's a treatment or you're having to go in, as soon as that tissue is cut, whether it's a tissue, ligament, you name it, it's never going to heal 100%. So using surgery sometimes to correct scar tissue may just end up leading to more scar tissue.
Oh, yeah, I don't want the surgery. I definitely don't.
Right. But it's always funny how that becomes an option, is we'll just go in there and cut some more scar tissue out or remove it. And I go, well, yeah, that could potentially leave more scar tissue.
Yeah, I don't know that they were so much telling me that to suggest the surgery as they were telling me that there just really wasn't anything I could do.
Well, there's a lot that you can do. And we've treated a tremendous amount of professional athletes that have problems on an ongoing basis because of injury and so forth. I'll give you a kind of a segue. There was years ago when before the Wizards were called the Wizards, they were the Bullets, and one of their guards kept microfracturing his feet. Okay. And subsequently, there was pain in the feet, as you can imagine. He was missing games. They had to do all kinds of crazy things. So he came into the practice, and we found in his situation, two things were going on. There was a biochemical imbalance, and because the guy was living on sodas, and it was the phosphoric acid that was causing the calcium, and subsequently, he was building scar tissue like crazy. But it doesn't have to be that. It can be other types of things as well. And the nerves to his feet were misfiring because the second bone, the smaller one in the lower leg, it's called the fibula, up by the knee, it had moved out of position. So it was constantly dropping and irritating the foot, causing the muscles to misfire. And then subsequently, the fascia, the saran wrap-like covering that covers all kinds of things in the body, was tightening up, and it was, in fact, causing scar tissue. So we fixed those things that were there, got him to stop drinking the sodas, and we fixed the muscles in his foot by fixing the fibula head, balanced his pelvis out, and he was good to go. He never had a problem again. So there's always a reason, and so what I would suggest to you is give Dr. Pina a call, and let her check it out to see if it's an acupuncture problem. And if it's not a direct acupuncture problem, she'll refer you to one of the guys that do the kind of work I just described to you. But I think that you can do something other than, what they're saying to you, and I think that there is a resolution.
They have suggested taking aloe vera tablets to just make it the scar tissue more flexible.
Nah, it's not going to do anything.
Okay.
No, it's not going to do that. Listen, I've been using functional medical nutrition for 40 years, and aloe vera is great for a lot of different things, but not for that.
Mm-hmm. Okay. All right. Hey, thank you very much.
You're welcome.
Good day.
888-630-9625. That's 888-630-9625. That's how you find us here, and how you find us when we're not here. RoselleCare.com. That's ROSELLECARE. This Wednesday night, Dr. Stephanie Pina is going to be your presenter. Call. Make a reservation. We'd love to have you as a guest. Dr. Pina, let's talk a little bit more about this hormonal dysregulation cycle that we're seeing. And, women, unfortunately, in this country suffer way too much. And, we talked a little bit about osteoporosis in this last call. That's important. And if the hormones aren't working, women are going to have a greater incidence to osteoporotic conditions.
Women and men.
Women and men. That's right.
Remember the ones you tied down earlier?
That's right. Oh yeah, that's right, guys. You're still listening. You too. You're going to lose your bone mass. But isn't that right?
Yeah, absolutely. I mean, the hormones do play a factor in that, and at the same time too, when the body's having to concentrate on hormone imbalances, it can't go back and kind of go in and heal and protect the body as well too. So with the bones, we automatically break down bones and try to rebuild it, and as we age, of course, that gets less and less. But if there are other factors of inflammation around too, the body becomes so saturated with having to deal with that something like bone growth and development is not the main priority. And that's where you start to see development in other areas like different types of cancers.
This Wednesday evening, I know you're going to get into the specifics of all kinds of different hormonal interactions. And it's important that people understand that they have the capacity, they have the opportunity to shift things, that you don't have to live with something just because. You have standard of care medicine, which means take this pill and call me in the morning. It's not okay unless you understand what the mechanism was that brought you to that event, and you're given the opportunity, the choice, to correct the events. You have to look in the beginning, not at the end. So keep that in mind as you call 703-698-7117 to register for this Wednesday evening's presentation at the Roselle Center for Healing. We're coming up to a break. And unfortunately, it'll be our last one. Don't go away.
105.9 FM and AM 630 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live, as you do every Sunday, 12 o'clock, same place, same time, same spot, wherever you're dialing in from. Or maybe it's your cell phone or your computer. You know, those of you out on the West Coast, you listen 3 hours early. Those of you other places, you do the math. But we would like to thank all of you for the time that you spend with us, and we try to do as much as we can to support you and give you the information that you need so you can be an intelligent consumer of your health care, but more importantly, so you can know as much in some situations and many more in others than your physicians do. You need to educate them so they can serve you to the best that they possibly can, because they're all smart guys out there. They really get it. Unfortunately, the information that they get is, as you know, my opinion, is being kind of directed because of people who have, they want to sell you a product. They want to sell you a product that you have to have a prescription for, that you have to go down to the local pharmacy to get. Well, you know what I'm talking about. Anyway, I think enough's enough. Dr. Pina. I better not get off in that tirade. Wanted to talk about measles, mumps, and rubella. Okay, there's an interesting connection between the parotid glands, where mumps seems to localize itself, and the reproductive organs of the ovaries and the testicles. And what we see and what we know, if somebody hasn't, a man particularly, if he hasn't had mumps as a child and he happens to get them as an adult, he's going to get monstrous testicles, and his testicles are going to be very, very sore. Woman ends up with tremendous amount of ovarian pain, and that it seems to be related to that. But the other thing is that the vaccine itself can stimulate that same reaction. But more importantly, here's the thing: it stops that loop regulation from the pituitary to the ovaries or the testicles, because luteinizing hormone works on both of them, and it shuts it down. That's something that most people out there don't even begin to consider when they're dealing with, particularly later on in fertility problems, and also with people who are going into the initial transitionary stages where their immune system begins to drop. I don't know what your experience is there.
Well, it's interesting. My mind was kind of going somewhere else, but it was, I think of things that we go through as a child. Because we usually think about when we're going to get those vaccinations is usually during childhood. How does that affect our reproductive health later on? And when we have patients coming in for fertility issues now, I tell them the idea is not just to get pregnant, is that you have a successful live birth, and that child can also get pregnant later on too. They can have children. When we think about some things that happen with childhood, we don't think about our reproductive health right then and there, nor are we usually told about it. But we've had patients that came in that, men in particular, that have been in parts of the country that have had radiation exposure, that don't think about it as a child because they're running around. And then when they try to have children later, it affects them because things aren't functioning. So there's a lot to take into consideration, not just what our hormone levels are, not what our estrogen levels are, but also what basically happened in our previous history. What were we exposed to? What do we have the chance to change now that can affect everything? Whether we're processing hormones, detoxing hormones, or trying to create the hormones that we need to balance.
It's an amazing, from our vantage point, we see the pathways. We know what they are. We're trying to educate ourselves all the time on, the things that block those pathways. And so instead of trying to fix something downstream, we're fixing it where it started upstream and getting rid of the inflammatory blockages, getting rid of the energetic irregularities and so forth. But this Wednesday evening, you'll have an opportunity to listen, in my opinion, to one of the best that understands this intimately, Dr. Stephanie Pina. Give us a call and register for that class. We're coming up to the break. As always, too short.
Since opening in 2007, family-owned and operated Rose Kebab Restaurant has been proudly serving Northern Virginia the finest in Persian cuisine and delicious halal meat. Open 7 days a week and conveniently located in the Vienna Shopping Center, Rose Kebab prides themselves in serving up good food and good atmosphere, winning Washingtonian's Best Bargain Award for 7 continuous years. See for yourself. Visit rosekebab.com, read their stellar reviews, and like them on Facebook for updates. Mention this ad for 10% off through the month of May.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Roselle Center for Healing reminds all women to conduct monthly and annual breast exams, and consider a thermography scan from the thermography centers as an adjunct to your routine breast exams. Thermographic imaging can detect abnormalities years before a mammogram. And it's safe and non-invasive. For more information, visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take.